when a patient has an ALK-rearranged lung cancer, you still have all the usual options in lung cancer, just to go through them. So you have chemotherapy, even immunotherapy, and then what we call targeted therapy. So chemotherapy would not be the best choice for this patient up front because we have head-to-head studies that have shown that the oral agents are better than chemotherapy. And so that's a proven strategy to use an oral agent as opposed to chemotherapy up front. Immunotherapy is still a bit of a wild card. We don't have head-to-head comparisons. We know immunotherapy is quite effective in patients with high PD-L1 expression. But if this patient had high PD-L1 expression in an ALK-rearranged tumor, we still would push providers to choose a targeted option to address the driving alteration in this cancer as opposed to giving this patient immunotherapy. There's more that needs to be done to demonstrate the value of immunotherapy in this select patient group. But for now, we think the oral agents are so superior in terms of efficacy and safety that you wouldn't want to miss that opportunity. It's a little bit different in lung cancer than it is in melanoma, where we don't think kind of the same way, but they're different tumors. Fortunately, there's a number of therapies that are available for patients with ALK-rearranged lung cancer, both in the first and second line settings. In the first line setting, the first drug to come out was crizotinib. It was proven to be better than chemotherapy, and that has remained the standard of care. More recently, we have data from a trial called the ASCEND-4 study that compared a next generation ALK inhibitor, ceritinib, with chemotherapy, and it too was superior to chemotherapy, and that has become a new standard in the first line setting. So crizotinib, an option, ceritinib, an option. They both have been proven to be better than chemotherapy. There's yet another drug, alectinib, which is a next generation ALK inhibitor. Now, the trial comparing it with chemotherapy, we don't have those results, but we do have results of alectinib versus crizotinib. And we have two large randomized trials that have shown superiority for alectinib versus crizotinib. That's not yet an approved strategy in the first line setting, but I think it will be very soon. So that brings three agents in the first line setting: crizotinib, ceritinib, and alectinib. Alectinib has been proven to be better than crizotinib, but we have no data to say it's better than ceritinib. So I would say right now in the US, certainly, we have two next generation ALK inhibitors that look to be very effective in the first line setting and would be options for this patient.